So whether you're new to chiropractic or you've been seeing chiropractors for a long time, this roadmap to wellness will be very useful for you. This is going to go into depth on ways to ultimately bulletproof you. We want to bring stability to our body. We want to make our adjustments last longer. The whole goal with this roadmap is not going up and down, but continually climbing the peak. And there's really three things we need to look at. Is your treatment, just kind of passive, right? You're not actively involved. We're doing it for you. We're removing restrictions in your joints, so the massage is loosening up those tight, hypertrophied muscles. And then we're looking at diet, because there's inflammation in the body. We'll talk about that and how that can affect your nervous system and your immune system and just stress overall. We'll talk about the three different types of stresses, and then we'll talk about these little kettlebell symbols here, the fix. So ultimately, the fix is not what we do to you, but the information we give you to learn to fix yourself. It goes back to the old saying, you can give a man a fish or teach him how to fish. He'll be happy for the rest of his life. So that is my goal, to give you that understanding, that drive, and desire to fix yourself. Right? So let's start with you coming to the practice here. So we have this explosion, that's your initial injury. And a lot of people think, oh, explosion, that's like a car accident. But you're like, no, I just rolled out of bed, or I woke up funny, and my neck's just a little twisted. Just a little twisted. It needs to be put back into place. But we need to be careful with that, because anytime there's pain, we have to think there's injury. On some level, there's some sort of micro tear or damage, whether it's to a muscle tendon or joint or even a nerve can be injured. And they all have different healing rates. So we just can't think, oh, here's that sore spot. Go to the chiropractor. He's going to push on that sore spot. Usually I spend a lot of my time explaining to people that where there's inflammation, it feels bruised, like a bruised apple. There's, body has created this pocket of inflammation to protect that area because there's injury done. And you'll usually notice I'm working in other spots where it hurts. And you get annoyed, and I get annoyed that you're asking, because I'm working on what's restricted. That's my job, is to remove torsion from the body. There's no magical voodoo I can wave over a spot that's injured. The only thing can heal injury in all of medicine is your body, right? We're just trying to remove interference, trying to put the body in a place where it can heal. So that's the goal there. And same with massage. We're trying to loosen up the muscles, take that pressure off. And sometimes you feel like, oh, it's gone, you fixed it. Well, we worked on the cause. We didn't really heal the injury. It's just we took pressure off it so it feels better. There's still damage there. And I often warn people, okay, there's still damage here. Be careful when you're moving around because it needs to heal, depending on what it is. It's a muscle. It could be as early as 2 weeks to heal. If it's more ligament or even tendon, disc, joint, those are really slow healers, looking more at months. Nerves, very, very slow healers, if at all. So usually when we have pain radiating down the arms, the legs, there's been damage, there's been degeneration there for a long time. And we'll talk about disease, right? Because actually this is a disease, right? It's like tooth decay. You can have spinal decay. And again, we'll talk about those stressors in a second here, but let's get through this chart really quick. So just read these little bullet points. So injury can occur from traumatic events or can seem to suddenly appear without cause. We call this microtrauma. It's trauma over time. I'll say often that if you had arthritis showing up on an x-ray, it's been there for at least 20 years, maybe more, depending on how much degeneration we're seeing on that film. And you might not have felt it, right? A lot of people see their x-ray like, no, that's not mine. There's a big scandal back in like the 80s. People thought like chiropractors were just showing them x-rays from other people to get them to sign up for lifetime care. Our spine especially has a lot of mechanoreceptors because it's good at sensing motion, but not a lot of nociception, which is pain sensory to the brain. Your body's relaying pain to the brain, right? It's like, this hurts. Something's wrong here. Damage. Warning. Only 7% of our nerves actually do that job. And so you can have a lot of degeneration in the spine and your brain doesn't know about it. It becomes mechanically deaf, I call it, which is that springing sensation. So when I'm checking your spine, I'm kind of pushing in areas, I'm moving it around. It's not that I'm giving you a massage, I'm testing for joint play. And joint play lets me know that, okay, this joint is moving like it should, or, oh, it's moving too much. You can have too much joint play, so there's laxity in the joints, or it could be restriction. Okay, this is not moving at all. This is And there's those both are arthritis, actually. So you can have laxity, and that's almost like the first stage of arthritis. Arthritis isn't a great term because if you think arthro is joint, itis is inflammation. That actually lends us to think, okay, that's more like too much inflammation, kind of makes the joints a little too springy. We got too much inflammation there. Usually it's happening in an area that you're bending too much from in the spine. Now we'll talk about foundation training in a second and why that addresses that particular issue. Because you think about, well, what do you do as a chiropractor to fix something that's moving too much, right? Your job is to get things to move. Exactly, right? And maybe an area is moving too much because in other areas we're very restricted. So chiropractic can't help in that aspect where I'm getting something to move on one side, and I'll see this even in the hips or in the spine because there's different facets. The right side's restricted or the left side's moving too much. So we have a laxity, we have restriction. Both can create arthritis. They're just different stages of it. Later down the road, your body is like, well, I have to lock this down. So ligaments can't contract like muscles. What they do is they add calcium, and that makes it brittle. And that goes back to that mechanically death thing where it's just, you get these all little pockets in joints or even tendons. When we talk about tendinopathy, you'll have pieces of Play-Doh, and tendons are very springy, right? Muscles attaching to bone, it's supposed to be able to bounce around. If it loses that, it's prone to injury because it's just not bouncy and springy to recoil like it should for movement, to resist gravity. So whether you're working on diet or exercise, we're both kind of looking at the same way. You both tend to get better in this corrective phase. Some people not. And that's just these little spine symbols here. This little lumbar spine is chiropractic or whatever you're doing. It doesn't have to be a chiropractic model or massage. So passive treatments, passive modalities. So chronic pain, we have this kind of reoccurring, or it's just there, it's constant, it kind of gets better, but it never really goes away. So this is all a symptom that your system is not in balance. Whether the source of the problem be from the gut, muscles, or the joints. So those three-tiered things that we're talking about here. These little symbols. And we'll break each of these symbols down. The spine, the fix, and the inflammation. So generally, we're going to hit this plateau stage where you're spreading your visits out. You're like, I'm doing better. And then, boom, usually what happens is it drops down. Symptoms return. And we're questioning, why is this happening? I thought the chiropractor fixed me. And it might be not the same symptom. It might be somewhere else in the body. Just like when you're in a car accident, people hurt their neck. Pretty much like clockwork. Later we'll see the lower back start to show up a couple months down the road, maybe a year later. There's lower back issues. Spine is really one unit. It's a lot of different joints, but the chains of muscle make it one unit and how it connects. And that's something great about foundation training we'll talk about is the posterior chain, the anterior chain. Getting balance in the muscles takes stress off the joints, helps your adjustments last longer. So when adjustments no longer last very long or seem to be less effective, happens a lot. People are like, I used to get adjusted back in the day, and I was great for like a year. And now it's like, you can't even adjust me, doc. You can't even get the bones to move. I must be old. And a lot of times, we see it, yes, when we get older, the joints get stiffer. But there's 20-year-olds that have the spines of 60-year-olds I've noticed. It's all just giving injury time. It's not just a big injury like we talked about. Injury could be small over time. So we're trying to address these issues. So the issue may be related to biomechanics. So biomechanics is just a fancy term for our body's movement, how the joints are moving, the study of movement, really. And it's very underlooked study of science because we're always trying to just passively fix the body. There's not a lot of people, like physical therapists, trying to teach people how to fix their own issues. So when we educate people, they really empower them. Unfortunately, there's not a lot of money in that, which is why it's not very popular, right? That's big pharma likes drugs. So let's talk about the fix and foundation training. So we have stability versus instability. So the ability to hold your adjustment longer requires a healthy gut and strong spinal musculature. Foundation training. Term, I've used it several times already. This is one of the classic positions you'll see. And at first you're probably thinking, oh, this is the magical exercise I need. There is no magical exercise, I'll tell you right now. Foundation training, they're trying to train you, teach you principles of movement. They're trying to teach you how we move wrong in our culture, how we usually develop to move wrong because of a lot of disadvantages, which are really the advantages of our culture, which are blessings. Like we talk about like shoes or flat surfaces to make life easier, and sitting in chairs so we don't do a lot of squatting, so we lose hip mobility. Then we bend 4,000 times a day, so if we're bending from our spine, that creates laxity in certain areas, restriction in other areas, and we have this compound problem. And maybe even you're one of those persons, you come to get the chiropractor and you feel stiff, you feel like things need to move, but the chiropractor's telling you, oh, you're too hypermobile, you have too much movement. It's not that you have too much movement in every joint. It just makes adjusting you, especially by hand, very difficult because there's certain areas that like to bend, which makes addressing the restricted areas very difficult. You'll see this in a lot of people who even teach yoga, do a lot of yoga. They have this yoga spine where they're super, super bendy, but at the same time, they're coming to see me 3 to 4 times a week usually because they're in pain all the time. They feel stiff, they feel restricted, and they're doing all this yoga to try to address it. And that's not what foundation training teaches. Not that yoga is a bad idea, especially if you're very stiff. But for a lot of us, if we don't teach our body to stabilize the areas that are moving too much, we'll continue to drive motion where we're used to driving motion from. We all have dominant areas that like to move. We all have certain strengths, we all have certain weaknesses. It's about finding those weaknesses, balancing them out, and those areas that are always tight will finally be able to relax. So the fix. That is what that's all about, and we'll look at another slide here in a second. So join us for class. We have a couple classes during the week. It's not meant to supplement your normal workouts. It's really to help you teach you some principles for you to take home. So it's not something you have to continue coming to forever. A lot of people love it. I love teaching class. I love doing foundation training class. The reason why we have the kettlebell is sometimes we will include weight. I love kettlebells. They're very versatile. I think more people need to be using a little bit of weight because it helps us resist gravity. It helps us teach our hips to work, and especially our joints. The more kind of pressure we put on them, the more resistance we create. Makes your bones stronger, joints stronger, ligaments stronger, muscles stronger. It teaches us to resist gravity. A lot of cultures, they're used to moving and lifting, and that's good for their spine, right? So the more symmetry and strength we bring to the body, the faster healing will occur, and the less susceptible to injury we will be. The less susceptible to injury our bodies will be. It's all about that gravity resistance, bringing balance to the muscles. Big chain, not just like bicep or tricep. We got to think about the muscles as big units, big slings that run through the body, like your hamstring attaching to your glute max, attaching to your thoracolumbar fascia, inserting across the body into the lat, creating big X's. We have the posterior oblique slings. We have the anterior oblique slings that are holding you together. Anterior chain, posterior chain. These are big slings of muscle, different muscles connected. Even when we talk about the spinal erectors, they're really, even the deep ones, they're little tiny muscles, multifidus muscles, transversal spinalis muscles that are running and wrapping the spine, encasing it. We don't see enough models. We just see the spine by itself. And we look at it and we're like, oh, this thing is weak. Of course it's going to get degenerated. There's all these muscles that encase it. There's atrophy. They're not being worked because we don't teach our body to resist gravity. We just compress our joints all the time. So that's why we start replacing discs and doing all these hernia surgeries and fusions, is a lack of strength in those deep muscles, which are designed to protect and wrap and really save the joints. So can arthritis really be dealt with? It can definitely be managed, right? If we stabilize the muscles, really arthritis has no reason to be there. And remember, it's taken at least 20 years to get there. So if you stabilize, it might take it 20 years to disappear, but our cells regenerate. They say their whole body regenerates after 11 years. So it's possible that you'll see it disappear in time, but a lot of us have disc herniations, we don't even know about it. So we can just continue to stabilize the spine. Let's not let that degeneration get any worse, at the very least. Same with someone who has like scoliosis. So the goals we're looking for is consistent maintenance. Do you ever stop going to the chiropractor? No, it's like, do you ever stop going to the dentist? You still go, you want to maintain, you want to get your checkup. Chiropractic, we're better at prevention, right? It's not so much, when you've really injured yourself. That's when people tend to come, is when they've really broken themselves. Sometimes you really hurt yourself. I'm going to do very little on that visit. So I know you're injured, I don't want to make it worse. It's like you sprained your ankle. It's like, what do you want me to do? It's all swollen. It's the same thing when you sprain your spine. It swells up, it's injured. The last thing it wants to do is be manipulated. If anything, I'm going to work all around it, try to take torsion out while being very careful not to hurt it. But if we get rid of those restrictions and balance, help you move better consistently, we're not going to get those big injuries. Because injuries are just going to get worse and worse and worse throughout life if we don't stabilize. Next, we'll talk about this inflammation. It's kind of a hidden thing that we see. So we got the detox, right? And we don't want to consistently detox, but sometimes it's important just to detox and then make little subtle changes to the diet. So we have this gut connection to the back and inflammation. So muscle irritation can be a referred pain from organ damage, dysfunction, inflammation. So when we have organs are damaged or the nerve is being injured or pressured, going to an organ, or the organ is just full of toxicity, it's going to send pain back up that nerve. It's going to refer it to different places. Like we know, okay, the liver or gallbladder might hurt my right shoulder. I have this consistent right shoulder problem. I'm not saying you have liver damage, but as an example, right? So organs don't just generally hurt. You don't really know. Our heart doesn't hurt until heart attack comes, right? But there could be damage there. We just don't know about it. Same with our gut. It could be we could have a lot of dysbiosis and inflammation, leaky gut syndrome. We know our digestion isn't working well. We have this chronic back pain. We don't really connect the dots. So that is another thing we'll look at here in a second. So all the goals, getting to the wellness stage, which is kind of that peak performance. Like I said before, you don't really ever reach your peak. You're just getting better. You know, who you're competing with. You're competing with you. So if you ever come to class, stop looking around at other people who are lifting more weight than you or moving better than you, because you're just competing with yourself from last class. A little better every day. Just remind you, healing occurs from the inside. We just facilitate it. All right, so let's look at correction. Chiropractic, massage, and other passive modalities are designed to eliminate torsional forces, that twisting in the spine or the hips, or it goes into the knees and the elbows, the wrists, everything can be affected. That's why we adjust your ankles and your elbows and your shoulders, because it all could be connected. A lot of it does generate, axially from the rib cage and the spine, but things can be from your feet or your hips or your knees that are throwing everything off from the ground up, or even from your hands, because we're using them a lot during the day. So eliminating torsional forces on the body that are linked to neurological stress and injury. The twisting and imbalance of our muscles is a process that can insidiously and sneakily, without us knowing about it. We talked about mechanoreception and nociception, how we might not know, because pain is not always the best indicator that there's a problem. And usually when I say there's pain, it's like tip of the iceberg. If there's pain and there's injury, you got to think about that. 8 out of 10, 9 out of 10 of that iceberg is underwater, right? So there's a bigger problem below it than what's on the surface. Insidiously progress without our knowledge, and set our bodies up for injury. So we refer to this as instability, especially if you're getting injured all the time. You're always spraining the same ankle. You're always hurting your back. Maybe it's moving around, but it's still instability. So addressing torsion and imbalance is only effective long-term, like we showed on the roadmap, if the correction phase is juxtapositioned with re-education, right? So that's the foundation training. And it doesn't have to be foundation training. It could be just kettlebell training has been really good with a lot of low back pain, a lot of studies on that. Just lifting in general, good to train our hips to work, train our spines to decompress, drive upwards. Yoga, body weight stuff, like foundation training is body weight, but it's teaching a lot of the same mechanics as lifting, which is it's gravity resistance versus just mobility work. Or I'm going to get on the treadmill and just run, which can be very damaging for the joints if you don't actually know how to resist gravity. So A lot of people hear me talk and they're like, oh, I just need to move more. Remember, it's not about movement more, it's about how we're moving. If you are in pain, you have suffered injury. Remember that. Even without a traumatic event. Accepting your condition has been regressing for some time, even before the pain appeared, is the first step toward making lasting change and adding life to your years and years to your life by removing stress. Stress can be mechanical, toxic inflammation, or emotional, but they are at the root of all diseases. A little chiropractic saying is the three stressors are thoughts, traumas, and toxins, right? So thoughts is the emotional aspect that can create stress in our body, which can create mechanical stress or even gut stress. We'll talk a little bit about the sympathetic state of the body. So thoughts, then we have trauma, which is either big injuries, you broke a bone, or you sprained an ankle, or just trauma over time. Little traumas, how we're moving, how we're breathing, how we're sitting, how we're not moving optimally can create damage to the joints. Like I say, you're either damaging your muscles or you're damaging your joints. If you damage your muscles, they got lots of blood supply. When you're working out, what are you doing? You're creating micro tears in your muscles. They're building back stronger. Create micro tears in your joints, they're going to build back stiffer and arthritic. Right. Thoughts, traumas, toxins is the inflammation. It's the gut, what we're putting into our body. It doesn't have to be necessarily what we're eating. It could be what we're breathing, and stuff like that. All right, so we'll talk about inflammation here. So when exercise and chiropractic seem to fail, right, a lot of people say, oh, I went to the chiropractor, it didn't help. There's a lot of stuff going on. It's not that the chiropractic didn't help you, just didn't solve all your problems for you. And usually chiropractic is a very useful tool. It's like when you're working out, you're going to notice amazing changes after the first visit. You actually might be more sore after you work out the first time. You wake up the next day, I'm never doing that workout stuff again. I'm sore. I'm never doing that chiropractic stuff again. I'm sore. It's a lot like that. I'm making changes. I'm putting stresses into the body. It's going to build you back stronger in the long term. Same with the re-education phase. So when exercise and chiropractic seem to fail to relieve symptoms, we may be looking at a systemic inflammation in the body. It's the whole body. The source of this is from our enteric nervous systems. That's your gut. People talk about your gut feeling, your gut brain. There's so many nerves in here in our gut where our immune system is. So nervous system is where digestion and the immune system is regulated. We talk about dysbiosis is an imbalance in our gut flora. So we have bacteria in the gut, we have yeast in the gut, and these are all help to break down our food so our intestines can absorb the nutrients to our body. If there's things that our body's having trouble breaking down, it creates inflammation. We have this mucus layer in the intestines that gets thinned, and then we get particles or proteins, whatever, passing through this layer and get into the muscular layer in the intestines, which causes inflammation and stuff there. But they disrupt absorption of essential nutrients, like I said. So most of us walk around on fire with inflammation and are unaware. We don't even know. I had a patient the other day, feeling his back. I'm like, your spine feels like it's floating in inflammation. And there's something going on. Go home and take care of your gut. Because I could feel like this wasn't like a spine issue. Sometimes your chiropractor can just tell. Like we know when you're about to get sick before you do. Because there's that inflammation. He had no idea. He just was like, my shoulders hurt. So we think our chronic pain is usually musculoskeletal, muscles, bone, but there could be deeper causes. All right, the fix, re-education. The average person breathes over 20,000 times a day. Some of us breathe way higher. Generally, we should be doing slower, longer breaths. So 20,000 is probably more optimal. And we bend 4,000 times a day. So a lot of movement. So foundation training first starts you off with a lot of breathing, what they call decompression breathing. You're training different muscles, a lot of your serratus muscles. Anytime you hear serratus, you're thinking rib cage expander muscles. You have 2 sets of posterior serratus muscles. Read a couple studies on how people with COPD, these serratus muscles are very atrophied. They're not active, right? So they get these very stiff rib cages because they're breathing with just their shoulders. They're not getting a good the expansive diaphragmatic breath. And it's different than yoga breaths or some of the breaths you've done before. Maybe even more of like a Tai Chi breath. But you're actually it's a very stiff breath. You're breathing into areas that are really restricted because we're trying to create a better pathway for the breath to happen. Not that you should be breathing very aggressively like this all the time, trying to break things apart, but it's engaging muscles, stretching other muscles, creating balance. And then when we're not thinking about it, we're going to take a more natural breath, because your body never wants to push into restriction. It wants to breathe where it's easy. So we have cartilage in the front of our ribs. That's usually where we expand. Right? That's usually, the shoulders lift or the chest opens up, which compresses the back, what we call about the posterior chain, right? All those muscles back there compressed and tight. You're wondering why your back hurts all the time. Imbalance. One area is moving too much, another area is not getting expanded and moving enough. And this same idea I'm just going to repeat over and over again. So let's move on. Re-education of the muscles to support our skeletal frame and resist gravity is an overlooked phase in bulletproofing our spines, along with all our other joints, right? There is no magical stretches or exercises that will fix all your woes, but training your body to approach movement as it was designed to do will yield results in time. We all have a lot of unlearning ahead of us. And that's the trickiest part. You're learning a new thing. It's getting people to stop breathing and stop moving the way they've been taught to do it their whole lives. Even when they're trying hard, they're automatically pulling from these ideas they were taught when they were younger. So a lot of that I'm trying to get you to let go of to really help you understand proper mechanics. As babies, we start out right, and along the way, we forget how to use our hip mobility and support our upper body properly. Most babies, they're toddlers, are squatting, they do a lot of crawling, they're developing their spinal curves. I don't know if he's still teaching, but I remember when I first started, even before I found foundation training, it was a guy called Nathan Maxwell, pretty much taught people exercises based on the movement of toddlers, like rolling, called the banana roll. I do that, I teach that to all my patients, and they hated it. Squatting, trying to hold a flat foot squat more, stop squatting with your weight in your toes, getting your weight in your heels, doing more crawling type motions. All very corrective because there are a lot of hip driven motions. And then we turn into people who are upright, who bend from our spines and stop using our hips. Because we no longer have the environment to challenge our hips. Everything's flat, and we wear shoes, or the 26 bones in our feet aren't articulating and moving like they should be, and 3 arches of our feet aren't gripping and grabbing like they should be, and they're not connecting up the chain to our hips, and our hips aren't being taught to push and drive our spines up, and everything kind of fails from the foundation, hence foundation training. You get a strong foundation, supports everything. Repeating that, flat surfaces, chairs have eliminated the need for hip mobility and strength in our culture, and instability and stress are the results we are seeing. It's a little out of order, but we'll continue with re-education here. So our bodies were designed to bear weight, hard labor involving lifting forces. Our feet drive into the ground, our hips hinge, and drive back and pull our pelvis, that pubic symphysis backwards. Pull our pelvis to our frame's center of gravity, our frame, our axial skeleton, our spine, our rib cage, getting that pubic symphysis bone underneath our center of gravity, and even training it pull back even farther, which is the corrective phase. So a proper lift should always be hip driven, and that's easy to say. Teaching people how to use their hips is different, because you're like, oh yeah, I use my legs, and then I watch them bend, and their butt tucks, do a little butt wink, lumbar spine flattens, and they got their knees bent, but they're actually not using their hips. They're driving their knees, they're killing their knee joints, they're not getting good ankle mobility. The hips really aren't doing the lift. The spine is not locked and lengthened, right here. So hip driven with the spine staying locked and lengthened to protect its joints, discs, and nerves. You ever seen a really big power lifter? They're not arching their back when they're about to do like a deadlift, right? They're going to pull the hips back behind them. They're going to kind of almost flex. They're lengthening and flexing the spine. And that's very similar to what foundation training teaches. Because we want to engage all the muscles, big, wide, lat-engaged breath before we lift something up. When we were first doing this, we're really overdoing it. but we're teaching our body how to move. So we're over-exaggerating at the beginning just because we've so underutilized these muscles. Full body movements, such as deadlifts and weighted squats, are great correctors because we can retrain the hips to be the main movers of the body. Form is always an issue, even in those who have been lifting for years. So our clinic recommends foundationtraining.com. It's a great platform to learn how to use your hips properly so heavy lifting won't set you back. It doesn't even have to be heavy lifting. Small liftings, little lifts over a day, picking up your baby. It adds up. We want to train our body how to lift optimally. Clinic runs regular classes so you can attend to help you understand foundation training. It's hard to learn on your own. They have a great baseline training program which walks you through the basics. And definitely doing that with class is the best way. A lot of people just want to do class. A lot of people just want to do the videos. It's good to get a little bit of both. Even me, when I was getting certified in this, it's like having all the coaches come around, kind of pick you apart, help me pick up a lot of pieces that I was doing wrong. It's hard to see yourself when you're doing it. So we all got some learning to do. It's annoying, but it's important. These principles are just as important as your chiropractic massage care when helping you stabilize injuries. So the roadmap to wellness is a reminder that we need re-education that changes how we move, not just corrects it for a short time. That is the true fix. So correction. We're going to get deep into the weeds here, but let's get through it. Most diseases progress slowly. Degeneration in your joints, discs, and tendons is no different. Even little aches and pains can be warnings of pathology in the musculoskeletal system. Yes, I said pathology. We're talking about a disease here, and it's good to start thinking about it as a disease. And it can really cause a lot of diseases, as we'll see. So your doctor of chiropractic and massage therapist can only help remove the harmful mechanical stressors from your body, but can give you diagnostic insights on what type of movement patterns and positions may be causing you harm, causing you damage. So we do not claim to correct injury or spinal diseases. We consider our job to be the removal of stress that can lead to these issues given time. By the time torsional or compressive forces have caused injury or disease to our bodies, simply removing the cause will not automatically heal the damage that is done. So chiropractors adjust subluxations, a joint that is in malposition, not aligned properly. So this is always causing nervous system interference. Most often, a subluxation can exist without pain, causing issues elsewhere, which we call compensations. When we pop our own spine, we are correcting a compensation, but not the cause. The subluxation requires a very specific adjustment requiring years of analysis and skills to get the right speed, force, torque, and contact to correct. A lot of times I'm looking around your body and taking my time and really trying to figure out what exactly needs to be adjusted, not just popping everything possible. So doctors of chiropractors spend an average of 8 years in college with education of the musculoskeletal system that surpasses that of a doctor of medicine. These adjustments can be performed without the need to pop the joint, which is simply a release of gas from the capsule and does not indicate realignment. So soft touch tools such as the arthrostim or the integrator, which is my favorite, or drop tables are other ways corrections can be made. Just as exercise is training your weaker muscles to support your skeletal frame more effectively, chiropractic and massage therapy is training your restricted joints and tight muscles to relax. So you mentioned above that a subluxation causes nervous system interference. This can be to all systems of the body, but when we are discussing muscle balance, it can cause inhibition. So inhibition means the nerve isn't firing to its target muscle properly. Every nerve goes somewhere, right? Organ, muscle, does an action or reports a problem. So inhibition means the nerve isn't firing to its target muscle properly. This results in muscles atrophying or becoming taut, which is overstretched. A lot of times, a person's complaining of a tight muscle. Oh, it's so tight. It could be taut, right? Which feels tight. So releasing it can give you some relief, but it needs to be strengthened, ultimately shortened. Ultimately, this leads to instability, tendinopathy, and arthritic changes over time. I say all this to remind you, disease creeps in slowly, and maintenance chiropractic and massage visits are required even for someone who is doing all the right strength training, foundation training, or eating the perfect diet. Can't just eat all the kale in the world. Still need your chiropractor. Lastly, almost done, let's talk about inflammation. So toxic stress from the gut can be related to imbalance in the musculoskeletal system or from subluxations. Stress on the nervous system can plunge the gastrointestinal system into dysfunction through irritation of the nerves that go to the organs that process, filter, and absorb our food. So mechanically, our inability to squat and breathe correctly can also affect how this system works. So examples of this are bowel elimination. We sit on a toilet, right? Other cultures, what do? They squat over a hole in the ground. Spend some time in Africa. I know. If you haven't done that before, it's very difficult. And growing up, my squat was terrible. That was a rough time for me. They hang out. You see the other cultures that are playing a game of chess and a flat foot squat. That's really good for getting the bowels moving, right? So acid reflux, remember your esophagus it spears through your diaphragm, along with a bunch of other things. So if diaphragm isn't getting stretched and worked and activated properly, it's going to affect these canals, right? And the sympathetic state, right? So mechanical stress, if your posture is in a stress state, it's going to make you think you're in a stress state. So back to our 3 T's, thoughts, traumas, toxins, they can be connected and related to each other. So trauma can create emotional, just as emotional can create trauma. It goes both ways. We tend not to think about the mechanical causing emotional, but it actually makes a lot of sense. Like you're in pain, not a good state of mind. So the sympathetic state, so examples of that are faster breathing, rapid breathing, heart rate's increased, gut's not working, stuff like that. Or parasympathetic tends to be the opposite. There's a lot of vagus stimulation. That's why chiropractic works so well. It can actually stimulate the vagus nerve to adjusting C1, the top bone in your neck. That's why you feel so relaxed after an adjustment is we've stimulated parasympathetic. So inflammation results from what we refer to as dysbiosis, imbalance of the gut flora that can wear away the mucosal layer of the intestines. It's the mucus layer, not the muscle layer. So you got the mucus, muscle. Muscle's where the nerves are. The mucus layer has no nerves. So once you get inflammation in that muscle layer, often we feel that gut hurting. And the gut's not going to hurt. It's going to hurt in your back or somewhere else, down your legs. It can cause maybe even sciatica sometimes. So this is wildfire. It's a good word for it. This wildfire of chemical irritation, right? Inflammation can be chemically irritating, damaging to everything over time. And what do you think about your immune system? It's confused. It thinks there's foreign invaders in the muscles. It's really just food, but it thinks there's something here. So it's your own immune system attacking you. And some of you were thinking, this is autoimmune. So a lot of times you think autoimmune, it's like a death sentence. You can do nothing about it. These 3 things we're talking about can help a lot with autoimmune. You don't have to just accept I have psoriasis, psoriatic arthritis, I got ankylosing spondylitis, all these other gut diseases. Yeah, we all have a cross to bear. We can have something genetic, for sure. But autoimmune, why is your immune system overreacting? That's a better question to ask. Stupid immune system. Maybe it knows what it's doing, right? Maybe it doesn't have the right environment. Maybe it's combating something, right? If there's a wildfire of chemical irritation, people are like, let's throw antibiotics at it. Not the answer, right? Sometimes it is when you really got to put it down because it's going to kill you, but it's kind of a last resort. Wildfire, chemical irritation can cause disease in these organs, right? It's there long enough, toxicity, right? Cancer, stuff like that. Can irritate the nerves that go to the spine, causing spinal pain, which is the least of your problems, right? Back pain is honestly the least of your problems when we're talking about inflammation here. It's disease. Organ disease is what we really fear. So getting adjusted can it help? Yeah. Working out, can it help your gut? Yeah. Are we connecting some dots? Good. Also, it's going to severely limit the amount of nutrients we get from our food. So that's important as well. Last little thought here. So gastrointestinal issues also involve our immune system. So it's the enteric nervous system. We talked a little bit about it, right? So it's the defense system of the body. It's your mucus, histamine. It's trying to attack bacteria, attack these foreign invaders, close them down, either eliminate them or encapsulate them, get them out of the body. Sweat them out, cough them out, vomit them out, however it's got to do it, it's going to do it. And that's when we feel sick, right? When the immune system is active, we call it sickness. But really it's healthness, right? It's a sign of wellness that your immune system is working, right? There's always toxins. Kind of your body works on the back burner with the immune system. Like this guy was talking about, well, the inflammation, he didn't really know he was sick. You could feel it. Feel his immune system was working. Next visit he came in, completely different spine. Just had some toxicity going on, his body eliminating. And sometimes people just, their immune system isn't working at all. They're like, I never get sick, and then cancer, right? Because inflammation is good. It kills cancer cells. Getting sick every once in a while is actually good. And this is hard for a lot. When I talk about this, and they're like, that's the dumbest thing I've ever heard in my life, son. Getting sick is good. Right? It shows your immune system's working. Should get sick a couple times a year. And that's, I know this brings in this whole COVID thing, right? Because a lot of this is, are we trying to address this with all these vaccines, or are we allowing the body to actually work? And that's the big question. I'm not going to give you the answer. You can just answer that one on your own. Let's keep moving before I get myself into trouble. So, the enteric nervous system, it's the master control for a body's self-defense mechanisms for toxicity. So we are taught to think that sickness is symptoms such as fever and mucus and coughing and hacking and all this stuff, but these are actually signs your immune system is working to take out the trash. So short-term inflammation is a natural response to infection and toxins. For many of us, our immune system is underactive and we are unaware of the disease processes taking place. So there's a balance, right? Chronic inflammation over all the time, your gut's always angry, yeah, it's going to lead to disease. A little bit of inflammation, good. Your body takes out the trash, it's done, right? Might not even notice it's happening. Sometimes there's a lot of trash, you're going to notice it, right? And sometimes we get, I remember like going through finals, in school. You get so stressed, you're not sick. As soon as you're done with finals, your body's actually able to relax, go into parasympathetic state. Your body's like, okay, it's time to take out the trash. Immune system's going to start working again. You're sick for a couple of days. Some of us never are able to transition, right? If you're always stuck in a sympathetic state, chronically stressed, you're not necessarily going to get sick. You're just going to build toxicity. So a lot of times you can build toxicity in your body. I'm just going to sequester it. It's essentially it's a tumor, right? And eventually that can break out and it can just metastasize throughout the whole body. This is not always happens. I'm just giving you some examples. Stressing our body through changing up our diet a little bit, eating healthier foods, getting adjusted, strengthening our body can help turn the immune system back on. So that's the point of inflammation here. And I'm done. Thank you for bearing with me. I hope that at least got your wheels turning and gave you a desire to work on these three things. Removing restriction from the body, strengthening the weak muscles, bringing balance, and getting rid of that wildfire of inflammation. I've been Dr. Klein. Thanks for hanging with me. Have a great day.